Medicare doesn't cover long-term care. Okay, so if they don't, then who does? With long-term care, you have basically three options. You can either self-fund, which means pay for it yourself, get a long-term care plan, which the premiums can be pretty expensive, or Medicaid will come in and pay your nursing home or long-term care bill. So let's say you self-fund. The average cost for a nursing home, a one-bedroom private nursing home in the United States, is about $130,000 a year. So let's say you saved up $450,000 for retirement, and that's kind of on the higher end. You're looking at about 3 years in a nursing home before you run out of funds. And that's if you weren't planning to save any as inheritance for your children or grandchildren. The second option, long-term care, you pay into a premium, it might be $100,000, but if you're in a long-term care or nursing facility for 5, 10, or 15 years, they're gonna pay no matter what. Third option is Medicaid. This is the option that a lot of people think that they're going to do, but they don't realize the repercussions of it. So what a lot of people don't know about Medicaid is that they don't just start paying immediately. If you have funds, they will make you spend that down before they come in and pay. So for example, if you have that $300,000 or $450,000 I said earlier saved, you have to use all of that on your long-term care first before Medicaid will come in and pay. They take a huge percentage of your Social Security check, pension, whatever you're getting as monthly income to go towards your care, and then they'll pick up the rest. So you're left with very little for necessities like phone bill, clothing, money to give to your grandkids on Christmas. And then what happens after you pass away? So if you have a house left over, they could come and try to recover that to pay what they've paid into your care. So your family home that you've been saving to give to your children or grandchildren, they could come in and recover that. Now, there are rules and regulations around this that can protect some people, but they don't protect everyone. And many people are blindsided by this. Oh, and by the way, you can't just give all of your assets away. Medicaid does do a 5-year look back to see if you've given anything for under fair value. There are also only a limited number of Medicaid beds. What I mean by that is that if you go to a facility, you're not going to get the nicest facility that you want that's 5 stars, that's down the street from your daughter or son. You might get the one that's 2 hours away and it's a 2-star facility because that's what Medicaid will cover. So the two things that you really need to ask yourself when you're planning for long-term care are, do I want to leave anything to my family? And who do I want in charge of my care? Do I want the government in charge of my care, or do I want my kids in charge of my care? If you haven't started planning for long-term care yet, now's the time to do so while you can still health qualify to even get a plan. If you need help doing this, my name's 𝗲𝗄. I'm a licensed insurance agent at the Senior Savings Network. You can also follow us here for more daily educational videos and Medicare updates.